share the screen so I can share some presentation. So the next we're going to be looking at is a stroke. Background information. In this particular case, we had FY2 in a GP surgery, and the patient has made a telephone appointment with you. He's a 58-year-old man. His presenting complaint is, "Doctor, I fell down 1 hour ago," or "I fell down this morning." When was it this morning? 4 hours ago. When you ask properly, he's going to tell you he's got weakness in his right side, on the right arm and left arm, or left. It could be right, it could be left. He has a past history of 2 previous myocardial infarction and had a coronary artery bypass graft, a cabbage done. He takes paracetamol, aspirin, and simvastatin, and he's a guardian. He does not think it's something serious. He is not very keen to go to hospital. He thinks it's not something to be worried about. Approach to the task. You're going to take the history of the presenting complaint. 4. Okay? So the history of presenting complaint is a 4. Just going to change that. You're going to ask, when did he fall down? How did he fall down? What was he doing at the time? Then ask the symptoms for the fall. Did you have any chest pain before the fall? Any palpitations? Any headache? Any shortness of breath before you fell down? Any recent illnesses? Any flu-like symptoms, illnesses? Were you unwell in any way? Unwell in any way? Just going to go back to correct that. Yeah. Was he unwell in any way recently? Ask about during the fall. Any loss of consciousness when you fell down? This particular patient did not lose consciousness. After the fall, what happened? Did you manage to get up on your own? Any symptoms after the fall? Like what? Any weakness on any part of the body? Any weakness on your face? Were you able to talk? Any slurring of the speech? You might need a systemic review in this situation. Let's think of the differential diagnosis. Stroke being the number 1, fell down suddenly. Any speech problem, any slurring of the speech, any facial weakness, any weakness in your arm or your legs, any vision problems. And sometimes, depending on the location of the stroke, if it's cerebellar, for example, may cause dizziness, may cause vertigo. The next differential is mechanical fall. Did you trip on something? Hypoglycemia. Okay. Do you have high blood sugar, diabetes? Did you eat in the morning? Dehydration. Do you drink enough? Infection. Any recent infection? Okay. Ask about any urinary problems, any pain when passing urine, pneumonia, any cough, any shortness of breath, any chest pain, a subarachnoid, any headache before that happened, any stiffness in the neck, the viral encephalitis, recent viral illness, myocardial infarction, migraine. Okay, so one more time. Stroke may cause dizziness, confusion, slurred speech, weakness on the face, or the arm, or the leg, visual disturbances. Hemorrhagic stroke may cause a headache. A subarachnoid will cause a headache and neck stiffness. The rest of the history, which include the epileptosa, the eyes, and the effect of symptoms. This is a telephone call. So therefore, after the history, you're going to move straight to diagnosis. I suspect you might be having a stroke. Pay attention. This particular patient is having the symptoms now. Because you're still having the symptoms, I'm suspecting you may be having a stroke. Especially that your symptoms started suddenly and they are still ongoing. Stroke is a condition in which there is a blockage of blood supply to the brain. It is common in people that have got other medical problems like what? Heart problems. You had a heart attack in the past. Okay, and that does put you at risk, unfortunately, of developing stroke. So what we're going to do, arrange immediate emergency admission. I'm going to call an ambulance for you, so you can go to hospital with an ambulance. So you have to call 999 for this patient and arrange a hospital. He will resist, doctor, is it something serious? It's not a big problem. Explain. Stroke is a very serious condition, potentially life-threatening, because sometimes you can suffer a second stroke that will be severe. You may lose consciousness. You may stop breathing. So it's an emergency you need to go to hospital. Can I go back to work tomorrow? Unfortunately, with a stroke, this is going to be a problem. What job do? You might need to stay off working for some time. Thank you.